Hello, everyone. Good morning. I trust you're all doing well this morning. You're welcome to the kickoff of the Data Made Simple project. Thank you so much for honoring our invitation. We're glad that you join us. Sincere apologies, we're starting 6 minutes behind 11 o'clock. We're trying to make all this join, but we still cannot wait for everybody. So we are starting now. Thank you so much. My name is Mercy Bolaji, and I'll be the moderator for this kickoff. And then I would also like to welcome everyone. Thank you so much for coming. Please kindly put your name, designation, organization, and also your state on the chat box as you join. Thank you so much. Today, we're going to kick off our Data Made Simple project. And I would like to run you through the agenda for today. And before I do that, I would like to let us all know the objectives of this meeting, why we are here and why we invited you to come join us for this kickoff. Our first objective is to introduce this project to stakeholders who are worthy of contributing meaningfully to this project. And we'll also liaise with you on ways of possible collaboration so that this project can become a success. And then we will go into our welcome and introduction, which is what we are doing right now. We'd also like to tell you about Stand With a Girl initiative, what we do and what we have done over the years. Just after that, we would be taking you through the overview of the Data Made Simple project. And then afterwards, we would give opportunity to you to respond to all that we have said and see ways we can collaborate to ensure that this project becomes a success. And afterwards, we end the debate. Thank you so much, everyone, for coming. Please kindly drop your names and designation, organization, and state on the chat box. And I would like to specifically welcome all our commissioners from all the ministries from the states. I would also like to welcome our permanent secretaries, and I would like to welcome the executive directors, chairman, and secretaries from all the states. I would also like to make welcome the directors and our esteemed partners. Without you, we can't even do this. That is why we have you come join us for this meeting. Thank you so much for coming. Would also like to welcome our fellow young people. The reason why we're doing this, yes, I can see you all on the chat box. Thank you so much for coming. With you, we can make Nigeria a better place. Thank you so much, everyone. So right now, I would just like to briefly take you through. If you're just joining us, please kindly put your name, designation, organization, and also your state on the chat box. We would like to have that. And then I would like to tell you that this meeting is being recorded. Thank you so much for complying. Thank you for coming to this Data Made Simple kickoff. Right now, I would just like to take you through what we do as an organization, a Stand With a Girl initiative, so that you don't just see the swag and then, oh, I hope it's not just about the swag, but it's Stand With a Girl initiative. And you know, we are not just standing with girls, we're actually standing with everybody. So thank you so much. Okay, so at Stand With a Girl initiative, okay, we are a youth-led, non-governmental organization that works to empower every girl child. Our goal is to make sure that every girl, no matter where she's born or found, is able to fulfill her maximum potentials. And just like we know that girls do not exist alone, and so that's why we strategically place ourselves to ensure that we equip those girls so that they can be who they want to be and they can achieve their maximum potentials. Next slide, please. Okay, so our activities and projects thus far, we are a youth-led non-governmental organization. Like I earlier said, we started in March 2016. And over the years, we've been able to engage parents, teachers, traditional and religious leaders who are our main stakeholders on effective parent-child communication, sexual and reproductive health and rights, child marriage, and girl-child education. We also build and strengthen capacity of girls on leadership, communication, self-esteem, advocacy, public speaking, storytelling for change, career development, emotional intelligence, and sexual and reproductive health issues. And we've been able to also promote menstrual hygiene management and women economic empowerment in Kaduna State and also in the IDP camps. We've also been able to provide technical assistance to adolescent and youth-related ministries, departments, and agencies, and civil society organizations over the years on adolescent and youth health and development programming and policies. Like we all know, we can't do all this alone. And so that is why we also work with other people who are also in this space to ensure that adolescents and young people are able to fulfill their maximum potentials. We also strengthen community partnership towards improving access to family planning and economic empowerment among internally displaced girls and women of reproductive age in Wasa IDP camp. Like I rightly said, that we also do our interventions in internally displaced persons camps. And then we strengthen the capacity of youth data advocates and monitoring and evaluation officers in 5 states in Nigeria. And also we are equipping adolescent girls in Nigeria to be champions of gender equality through female mentorship in partnership with Strong Enough Girls Empowerment Initiative. So this is all we do at Stand With a Girl Initiative. This is who we are, and this is how we are contributing meaningfully to healthy development of adolescents and young people in Nigeria. Once again, I also like to welcome everyone who has joined us. Please kindly put your name, designation, organization, and even states on the chat box. Thank you. Right now, I would like to introduce the Executive Director of Stand With a Girl Initiative and the Program Coordinator for the Data Made Simple project, who will be taking us through the overview of the Data Made Simple project. Please, can you put your hands together? I know I can't see everybody, but just put something on the chat box. If it's your favorite emoji, let's have it. Thank you. Thank you. Please, Ma, let's have you.
Thank you so much, Mercy, and good morning. I was going to say good afternoon, but it's not 12 yet. Good afternoon, everybody. Thank you so much for being part of this. We are very grateful and do not take for granted that you took time out of your busy schedule to be part of our Data Made Simple project kickoff and partners meeting. We're glad to be starting a new journey with you, and we're grateful because you being here shows that you're interested in being part of what we're doing, and we're very, very grateful. We'll go straight into the overview of Data Made Simple, and I know that you've been wondering, or maybe it's also familiar to you, that Data Made Simple. So one, what data and how are we simplifying it? So I would maybe start with my own personal story. It's the fact that growing in the development space as a youth advocate, I was so sure that my stories always won decision makers' hearts. So you tell them about the story of girls you've met with, how they're living in such a situation that people need to come to terms. But as I continue to grow, I know that stories are beautiful, but it's good to find data. Your story has to be data-driven and evidence-based. So it was, how do I then make sure I have data, but put life into the data, which is now the stories. And that was actually, for me, every data meeting, I became interested in attending data meetings. But when I entered data meetings, it's so boring and it's numbers. If you're also like me that don't like numbers. But I found out that I was not alone. A lot of people, and not just even young people, including programmers, had issues with just numbers. So for us, it was, how do we then, yes, use data, because data is life. And if you don't count a thing or a person, that person will not count. So it's important to use data. But how do we simplify data? And that's actually part of the reason why we brought Data Made Simple project. Next slide, please. So with the Data Made Simple project, I hope you can see my screen. Yes, we also look at Nigeria. Again, we are quite familiar with adolescent and youth sexual and reproductive health. And we know that internationally and nationally, I mean for Nigeria, they're daily making efforts. While we can say it's not enough, to ensure that data are being simplified, and not just simplified, but data are being disaggregated. So we bridge the gap of AYSRH data. So we have data that it disaggregated by age and by sex. And that way, we cannot just say, oh, young people, we're talking about young people and we're looking at 15 to 49. Yes, they are women of reproductive ages, but who are the young people, 15 to 24? What exactly is data saying about it? And with the NHMIS, which we have to congratulate again Nigeria for making sure that it's been disaggregated by sex and by age, we felt that it's not enough that we have data. And yes, data is, we have few data for adolescents and youth, but the few data, what are we doing with them? So maybe we're not doing so much with the data because they are not simple enough. And that's why the Data Made Simple project is meant, the slide before this, it's meant to analyze, interpret, and present existing AYSRH data so that it can be used for decision making. Next slide, please. So, and this decision particularly is to address modern contraceptive prevalence rates among young people in Nigeria. Again, for the Data Made Simple, in 2021, we were able to simplify data in 5 states: Niger, Ogun, Plateau, Taraba, and Edo State. And of course, this data was actually simplified into animated images, infographics. We use, of course, the existing data in those states. And at the end of the day, working with not just SWAG, and we, at this point, again, we're very grateful to the state that accepted us. Together with the state actors, we're able to have AYSRH storybooks. You can see some of the sample of the storybooks being displayed. And these storybooks were used for decision making to promote and advocate for better health outcomes for adolescents and youths in the states. Of course, looking at the progress, while it was just a 5-month project, the fact that we were able to simplify data and engage decision makers, either traditional leaders, religious leaders, commissioners, directors, and they made commitments which the young people are following up. We were happy to see that we are scaling up this Data Made Simple to additional 7 states. And these additional 7 states, which is why we're all here, are Bauchi, Kano, Nasarawa, Akwa Ibom, Oyo, Anambra State, and of course, Federal Capital Territory. And of course, it's worthy to mention and to say very big thank you to our funder, the Grand Challenges Canada, which is funded by the government of Canada. What is the goal of the Data Made Simple project? For us, the Data Made Simple project is to ensure that there is increased access to quality sexual and reproductive health information and services among young people in Nigeria. Again, when we look at the data, we know that we're not there as a country, and we want to ensure that our young people, going by what Mercy told us about SWAP, for us, no matter where you're born or where you're found, you have the right and you should be able to live your full potential. So for young people to have quality sexual and reproductive health information and services, Data Made Simple project is the best in your state and in Nigeria. Also, what are our key objectives? Objective 1 is we're interested. Remember where I started my story from. It's good enough that we have youth advocates everywhere, but how much of them are also participating in data for decision making? You would also agree with me that when we talk about meaningful youth participation, it's not only involving them at the beginning of the project when you're just designing, but we need to engage them during implementation, during monitoring and evaluation, which is basically where data come in, and at the entire lifespan of the project. So for us, we see in Nigeria where young people are meaningfully participating with data that affects their life for decision making. Also, we'll be working with state actors and strengthening their capacity. Yes, they know so much. We're going to be learning from them, but we will take it forward to improve those capacity that they already have on data used for informed decision-making and programming. Also for us is that we're interpreting AYSRH data into simple, friendly, catchy, and responsive format for decision-making. And last Lastly, is that we're promoting this AYSRH storybooks to improve the delivery of comprehensive contraception care and education. So for us, it's about this young person having access to adequate and accurate information about their health so that they can transit successfully to adulthood. And with this, I want to invite Ethel, who is the program coordinator of the Data Made Simple project, to take us into the nitty-gritty. I know I've been mentioning state actors and a lot of other points, but she would be able to break it down to say who are these key persons that we'll be working with. Welcome, Ethel.
So thank you, Margaret. That's our wonderful ED. So for that wonderful introduction. So I'll be running us through the project outcome, the project timeline and work plan, the sustainability plan, and also the scope. So I'll also now introduce myself again. I'm Ethel Usegale Atta, Program Office Coordinator for the Data Made Simple project. So like my ED said in the objective, the project will strengthen the capacity of the youth data advocates, state M&E officers, adolescent desk officers, local government officers in the states to simplify adolescent and youth sexual reproductive health data into something that is catchy, friendly, and also something that relates with the state issues, adolescent issues, and also key actions. So the story will have like a full package of the data, the issues, the solutions, key actions, and these data that will be developed, the storybooks that will be developed, will be used from these mentioned state actors in educating our key target audiences, which are one, our decision makers, two, our community members, and three, our family service providers. Thank you. Next slide, please. So the scope of the project, while working on existing AYSRH data, and we'll be looking at data on pregnancy and childbearing among adolescents and youths, contraceptive use, abortion, maternal and child mortality and morbidity rate among adolescents and youth, HIV and other sexually transmitted infections, sexual and gender-based violence, and harmful cultural practices. So all of this will be sourcing data and getting data that speaks about the issues from these states that we mentioned earlier. Next slide. So I'll be taking you through our work plan and timeline for the project. So the project's work timeline and work plan will be for 1 year. The project is a 1-year project, and in the course of it, we'll be having different activities that will be involved with in the state, and also that will also involve the state actors in. So first activity will be the kickoff, which we're doing now. And the purpose of our kickoff is not just to introduce the project, it's also to see possible ways of collaborating with us, because from our goals and objectives we've listed, we can't just achieve it alone. Collaboration has to come from the state, approval, commitment for you to let us go ahead, which will help in promoting the project. And that's done in February. Then in February too, we'll also be identifying adolescent desk officers from the state. We already know that, okay, we have adolescent desk officers from the state. So the team will be working with 1 adolescent desk officer, making it a total of 7 from the 7 states. And also 1 state M&E officers from the state, making it a total of 7 state M&E officers from the 7 states. And after identifying the state M&E and adolescent desk officers, the team will now work with the state M&E and adolescent desk officers in the selection of 5 local governments officers, making a total of 35 local government officers from the 7 states. And after this is done, and to be done in February, and after this is done, we'll also now work with the adolescent desk officers in the selection of youth data advocates. We said we want to also promote meaningful youth participation. So, and this project is about adolescents and youth. So getting youth to represent the adolescents will also play an effective role in the success of the project. So we'll be working with youth data advocates with the help of the adolescent desk officers and also youth-led organizations in this state. And after the selection and identification is done in February, March, we will be verifying existing AYSRH data. And how will this be done? Currently, the team is working with data experts in sourcing those existing data that speaks about the issues in the state. And once this is done, by March, we'll all send those data to the state M&E for verification and for validation, because we don't want to work with data that are not approved and does not relate with the state. So the M&E will also help us in the validation. And when this is done, by April, we'll be doing 3 major activities in the states. We'll be paying a courtesy visit to the primary healthcare boards, agencies, and Ministry of Health. And after we pay the courtesy visit, that same week we are coming for the courtesy visit, we'll be engaging the state's actors in capacity building training for the development of our storybooks. And for the first day, we'll be training or strengthening their capacity on data use visualization, how to tell creative stories using existing data, value clarification in the aspect of adolescent and youth health. It will be an interesting event too. Me, I'm already excited about it. I don't know about you. Then the next day, that's day 2, we'll focus on developing our story, having a good story that has both the data presentation, both the narrative that talks about adolescents in the state. And when this is done, the 3rd day, we'll create a work plan for dissemination and sensitization, because these storybooks have to reach out to our key audiences, which are our decision makers, family planning service providers, and our community members. And when this is done, the storybooks narrative will be brought back for finishing and production. And after this production is done, we'll send it back to the state actors for the dissemination. And this dissemination and sensitization will be done in April down to October. We'll relate the dates with you for us to confirm your availability, so that we'll be able to still adjust the dates depending on when the state will be free to have us. So after all of this is done, dissemination, sensitization, we'll have a project closeouts, and also national dissemination, where we will talk about the success of the project, the processes, how everything went, and after which, and that will be done November, after which we'll all wrap up and be happy about how the success and everything went on the project. So this is the work plan and timeline. What is our outcome? First of all, the project's outcome, we are looking at from our own team that these storybooks that are being developed will be used for domestication in the states, in national policies that has to do with adolescents and youth. Also, using the storybooks to talk about in annual plans that has to do with adolescent health, even gatherings that has to do with adolescent health for making decisions. These storybooks will really be helpful for the success of how adolescents and youth health are being, like, their well-being. Yeah. Then secondly, involving adolescents and youths in the data programming will help also build networks. Imagine a state where youth can also be represented in the aspect of data that talks about them. So it will also lead to representing youths in all, and once young people see that young youths are being represented in the aspect of data that speaks about issues on adolescents and youth, they will also want to have this behavioral change because they have a representative there. Thank you. So the next slide. So our sustainability plan, the first thing we're looking at is that having youth learn skills on data and knowledge on it will also help for proper understanding and also moving those knowledge they've learned to other younger youths. So imagine a state that already have youths represented in those states. So you have young people that are going to also be built up on data on adolescent and youth health. And with that, it will help promote sustainability in the state. Secondly, with our commitments gotten from the state's primary healthcare boards, agencies and ministries, it will also pave way for sustainability plans, because the storybooks will be used by decision makers to make change in the community. And also family planning service providers can also use these storybooks to create a youth-friendly service for adolescents and youth in their community, because it will help an adolescent have comprehensive knowledge on contraceptive use, prevention, and also how to access services when they need it. Thirdly, with the strengthening that we'll be doing to the state M&E officers and also adolescent desk officers, they'll also be seeing data, not just by seeing data numbers. You're also seeing it in ways that you can raise awareness and sensitization in the states. And people will start internalizing data in those states, because once local government M&Es are generating data, they are also seeing a way to disaggregate it into different ages, and each state will start owning their data, and that will also help for our sustainability purpose. So I think with these few points of mine, I've been able to convince you. So thank you, and I'll move over. Sadia will take over from here. Thank you.
Hi, everyone. Thank you for joining us so far. I wish I could just get hot coffee and send to all of you to just calm your tempers. You've been listening to us. Thank you so much. As my colleagues have said, like, one of the crucial parts of this project is collaboration, hearing from our partners, knowing what you think. And for virtually everyone that's here, you are a critical actor in the promotion of adolescent and youth sexual and reproductive health. And so holding this event is not just only to share what we are doing with the Data Made Simple, but it's also getting feedback from you, getting a response from you. We would like to know, okay, are there questions that you'd like answered, or you want to give recommendations or even commitments that can be made? And so with that, we would really like to hear from you, and we would like to start with our state actors. We would like to call on the person of the Honorable Commissioner for Health of Akwa Ibom. Please, if you are here or ably represented, please just raise your hand, and we'd really just like to hear from you to know what you think and how you can commit to this project going forward, please. Okay, so I hope that I do not mispronounce the name. Yes, we have Enike Miriam Chinyere. Please forgive me if I did not pronounce that properly, who is the administrative assistant to the Honorable Commissioner Anambra in the building. Welcome, thank you so much for joining us. And we have a hand raised. Okay, please. Please kindly introduce yourself. You'll be granted access to speak. Please unmute yourself, please.
Good morning, everyone.
Morning.
Yes, this is the Adolescent Health Desk Officer from Akwa Ibom State. This is Comfort. I'm so delighted to be a part of this program today. And I'm sorry I came in late. I've heard few of the things you've said. As the meeting progresses, we hope to join with you and see what we can do to ensure that our youth get the best of what we can offer to them. We are compiling our data, and very soon we'd love to share them with you so that we know where to come in and how we can be of great help. We hopefully, people at the top, by the time you come to see them and really explain things to them. They will be so happy to join you and see how we can push this project forward. Thank you so much.
Okay. Thank you so much, Comfort. We're so grateful that Thank you so much for your time and just sharing that with us. Please, we would like for others to also drop your comments in the chat box. And please drop your comments in the chat box. Going forward, we'd also like to recognize the presence of the Honorable Commissioner for Health, Anambra State. And if he's ably represented, please just raise up your hand and we'd like to hear from you. So while we wait, we also want to recognize the presence of the executive chairman for Bauchi. If he's represented, we would like to hear from you. Just raise your hand and you can speak and just give us your input. Thank you. Okay. All right, then we have for Nasarawa, we have the executive secretary. If he's represented, we also would like to hear from you. We have the executive secretary for Oyo State, and for the FCT, we also have the executive secretary. If you are represented here, we would like to if you are a representative, please, we would like to hear from you and just get feedback on what you think. And also for Kano, the Director for Public Health and Disease. So if we have anyone from the state that is either the adolescent desk officer or holds a position relative to adolescents and youth sexual and reproductive health, we really would like to hear from you. Just raise your hand and then you can speak. Thank you. Okay, Christiana, you can just unmute yourself and speak. Okay, please unmute yourself, Christiana. Okay, welcome. Okay, we have Christiana and Umar Abubakar with their hands raised. Please, Christiana, you can unmute yourself so you can speak. And after her, we can have Mr. Umar. Okay, Mr. Umar, while we wait for Christiana, you can unmute yourself so we can hear you.
Good morning. Are you hearing me? Are you hearing me?
Yes.
Okay, my name is Umar Abubakar from Bauchi State Primary Care Development Agency, Adolescent and Youth Friendly Health Services Focal Person. I need to have this presentation that presented for the first time. I want you to share this presentation for us in order to have a guide to us in order to place things in order in the state.
All right, sir. And we'll have it sent to you via email after this meeting.
Okay, thank you. Thank you
so much.
Thank you.
Thank you so much, sir. So, Christiana, are you ready to speak? Okay. We have Folake. Oh, Funke. Foluke, sorry, please forgive me.
Good morning.
Good morning.
Good morning, everyone.
Good morning.
Foluke is my name from Oyo State.
Yes, I'm sorry.
I want to appreciate you. I want to appreciate you for bringing this laudable project to Oyo State. We are indeed very grateful. Putting data in a simple form is something very important and very interesting. And we in Oyo State is ready. We are ready to support him fully. So, hello? Hello?
Yes,
Hello?
we heard that fully part.
Yes.
Thank
So
you.
we are expecting you in Oyo State.
Yes,
So we are expecting you. You are most welcome.
thank you so much.
But April is too far, please. April is too far. We want you to come on time and start your project in Oyo State.
Well, we will be liaising with you up until we actually show up in Oyo State, but we are so excited. We're so happy. You can see the joy on our faces the moment you said that.
Yes, you can see the joy in you too.
Yes.
So we are expecting you.
Yes.
So we want you to share everything with us.
Thank you.
Thank
so
you.
much.
Over.
Thank you, Ma. Thank you. So,
Hello.
hi.
Hello.
Yes. Okay.
Christiana Samuel from FCT Primary Healthcare Board.
Oh, welcome.
Yes, happy to meet you once more. Though we have been communicating, this is a very good venue to see you people face to face. You people, you are very welcome to FCT. FCT, when we presented our scorecard last year in African conference in Abuja, which took place in August last year, 2021, FCT had a very bad scorecard. Most of these activities for adolescent health is not happening in FCT. And most of the time, organizers like this your own, will come, promise to do one thing or the other. At the end of the day, will not say anything. So please, this time around, we are welcoming you with open hand, and we are waiting for you people to see your action. Being your name is SWAG Initiative, so we want you to swag here. So thank you very much.
Thank you so much, Ma. Thank you so much. We're so happy that we get to do this with you too. Thank you so much.
Thank
So
you. Thank you.
Yes, Ma. Okay. We have Ademola. Okay. 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 Okay, yeah, so we have the DPRS for Anambra. Please, you can unmute yourself and speak. Thank you. Yeah. Yes, you can unmute yourself.
Good morning, all.
Good morning, Ma.
You're welcome. I want to speak on behalf of Anambra State. The Permanent Secretary has directed me. I'm Mrs. Edith Wachuku. I head the Directorate of Planning, Research and Statistics in the State Ministry of Health, Anambra State. So we are overwhelmed to welcome the Stand with a Girl initiative in Anambra State. The adolescent youth sexual reproductive health has been awaiting partners to support the program. Is one of the programs that is being neglected in the state. If we can start with this WAG initiative, I think we're looking forward to seeing more partners to partner with the state on adolescent youth reproductive health. You're welcome to Anambra as we expect to meet with you. We are getting ourselves ready with the requirements that will key into this project as soon as possible. Thank you very much.
Thank you so much, Ma. Thank you so much. We're also so excited to come to Anambra State. We're so grateful that you're welcoming. Thank you so much. We also have 239164. You raised your hand to speak. Please, you can unmute yourself. Okay. 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 Mr. Ademola, Please, you can unmute yourself and speak. Thank you. Okay, okay, Mr. Ademola.
All right, thank you very much. We are happy to have you in your state. As my boss, the Irish coordinator, has said the other time, it's a laudable project which we boost our data in the states and other services also. We are very happy to have you and to also work with you. And we hope that you will fast forward the meeting with the executive secretary, though somebody is already representing him in this meeting, is attending to other meetings. So we hope that you will have a courtesy visit to him soonest so that you can discuss the project with him. All right, so that's all. Thank you very much. Over.
Thank you so much. Thank you for the reaffirmation. We're so grateful. And yes, like Ethel said, we do have a courtesy visit as part of our plan, and we hope to achieve that. If there are no other hands raised from the state actors, we would like to hear from our partners. I can see that we have SEGI here, and Society for Family Health, and we have some other partners. We would really like to hear from you. What ways can you support, or what questions you may have? We really like to hear from you. Thank you. Just raise up your hand, and so we can grant you access to speak. Thank you. Okay. We also have UNFPA here. Thank you so much for joining us. We'd really like to hear from you. Okay. Please, you can just, raise your hand and we'll give you access to speak. Yeah. So if there are any questions that you may have, we really would like to hear from you. Questions, recommendations, yeah.
Interestingly, Ethel did a great job.
I'm telling you, she must have clarified all the questions that there could be. Okay, we'll just wait a bit. I think that somebody may just have a new question coming up.
There will be questions, please. Because we will need to just hear from you. Recommendations. We're open to any suggestion and everything. So please, if you are not okay with what we said, please, you can.
Yeah. I know for partners, we have representatives from the states that we're working in, and you understand the states better because you have been on the foot and you've been on the ground working, and we really would like to hear your recommendations on how best you think that we can move forward. Okay. Okay. In the event that, okay, it's obviously that there are no questions, but if any question comes to you, even probably after this, we would like you, we're open to communication. We would be sending an email with a recording of this and the slides to just help you understand. But we would really like to hear from you. We're open to communication, whatever questions it is, we're open to hear from you. So I think I would hand over to Messi now.
Okay,
and we're done. Thank you so much.
All right, thank you so much, everyone. And like I said earlier, Ethel did an amazing job. And maybe I should let you know that we call her Data Mama here. And that's because she has all the data. Yes, she's Data Mama. So that was why I think that's why there are no questions. She just did everything. And like Sadia rightly said, we would be, yes, someone said the presentation was explanatory. Oh my God, you did excellently well. So thank you so much, but we're still open to your, if after now we know that, there've been a lot of information we've given out to you, and maybe right now there might not be anything you want to say about it, but please, you can always reach out to us, and then we will be sending the slides, like Sadia said, to you. So I hope we're not missing out on anybody who just joined. So if you just joined, okay, you're welcome. But let me not say that you missed some part of it, but because we'll be sharing the recordings with you. So yes, you didn't miss anything, but thank you so much. If you want to say anything, you can just say it before we officially close and then go for this. So right now, I would like you all to turn on your videos so that we can see your beautiful and handsome faces. So it's not just about our faces you've been seeing. We also want to see who are the people that have been giving us those, beautiful comments about how they would support us even while we go to the state. Thank you, Mrs. Risikat Aderibibe. She was the first person. I think I should give her a prize for doing this. Thank you, man. So please turn on your videos and let's just see you. And then, yes, before we officially close this meeting. Thank you very much, everyone. Yeah, that's it. Thank you.
Yeah, the next piece. I think that's all.
Okay, thank you so much, everyone. Should I say it was nice doing business with you? Yes, it was nice doing business with you. Thank you very much. Once again, my name is Mercy Bolaji. You've had presentations from the Executive Director, Margaret Bolaji Adigola, and of course, the Data Mama, Etel Osegaliata. We have Alimatu Sadia Ocheklie. We also have the people in charge of the IT, people that are behind the scene, making sure this goes well. We have Solomon. And so that you don't say that it's just ladies here. Please, Solomon, come and say hi to everyone before we officially close this meeting.
Hi, everyone.
Hello, Tochukwu. Say hello to everybody. Hi.
Looking forward to meeting you.
All right. Thank you so much, everybody. We really appreciate everyone who was part of this meeting. We say thank you to the representatives of the commissioners. We say thank you to the permanent secretaries and the executive directors and secretaries and chairman. We also say thank you to our directors and our esteemed partners. Thank you so much for every time we call on you, because we see the need to make the lives of these young people and adolescents better. You always respond to us. Thank you so much. We can't even thank you enough. But that's to say that there's much work to do with you. Thank you. So we are thanking you in advance. And then lastly, to our amazing young people, the reason why we are doing this, yes, of course, without them, I'm sure we're not even going to be doing this. Thank you so much for joining. And thank you. Do you have anything else to say? Yes.
Then for the adolescent desk officers, from next week, Ethel will be disturbing you. So please be available for me. Thank you.
All right, thank you so much. I think our executive director is still up. I don't know if she wants to say something before we go, just before we officially close this meeting. Okay. All right. So you would hear from us by and large. Thank you so much, everyone. We truly appreciate. Thanks for giving us your time out of your busy schedules. Thank you. And it's a close. Bye. Have an amazing Thursday. Enjoy work and do the best you can to make sure that every adolescent's life is better. Thank you and thank you. Bye. Bye-bye. Bye, everyone. Bye-bye.
But we need to upload it.
Is it? Yeah?